Hello, this is Dr. Mark Levandovsky. I am the founder and medical director of Preventive Medicine and Cancer Care here in Denver, Colorado, and I'd like to talk to you today about concierge care. We're going to be addressing what is concierge care and how is it that my practice fits into the concierge world and how does it differ. So first and foremost, there is a lot of misconception about concierge care. Um, it is not really about having a doctor in your pocket. It's about a relationship. It's a relationship with your patient when you actually get to know someone by spending the time to get to know them. You establish a rapport so that you actually know the not only just the bare medical facts of what moves a person, but also what is their psychosocial dynamic, what is their medical issues, what are their genetic issues, what is the family history like, what is the global comprehensive portrait and picture of their medical health in a very personalized fashion. That is largely being afforded by the fact that concierge care falls outside of the realm of insurance, so that we're not obliged to follow insurance guides and standards, and we can actually personalize attention to the patient in front of us, to the person in front of us. The So as a function of time, it allows for much more personalized interaction and individualized attention. Now, the main difference between a traditional concierge care and my program with preventive medicine and cancer care for patients and for interactions is that not only am I able to spend the due amount of time to get to know someone, to really know what moves them, and that takes about 3 to 4 hours for the initial intake for the appointment. But also, there is a vastly different expertise. Typically, concierge care is rendered by either a family practice physician or an internal medicine physician, and they very much practice and stay in the scope of the expertise as they ought. Now, in my case, not only do I have the internal medicine background and certification, but also that of hematology and medical oncology. Hence, the scope of services, the expertise, and the comfort level is drastically different than that of a typical general primary care. So, not only are we able to spend more time and establish that amazing rapport with patients, which is paramount, but also the structure of the program is really geared around finding number one, two, and three offenses to the most maladies in America. So, number one killer is cardiovascular disease, and hence, so much of my emphasis is placed on risk stratifying folks as to what their cardiovascular risk is. Number two killer is cancer, and that's right up my alley with preventive oncology. And I would much rather meet someone as a preventive oncologist than a traditional treating medical oncologist. So the reason why the testing is so comprehensive and extensive is because we spend a lot of time not only in establishing rapport and talking to people, but actually doing super extensive and in-depth blood work that has to do with cardiovascular disease, with inflammation, with lipid, with cholesterol panel, with inflammatory markers, with insulin level, with endocrine disbalances, with hormonal levels, and as well as organ function, really head to toe. And in addition to that, I incorporate extensive tumor markers that look at someone's potential risk for cancer, in addition to markers of irritation and inflammation in their blood vessels and organs, which could also give us a clue. There are markers of iron metabolism. There are markers of bleeding and clotting that we look at. There are markers of what the blood looks like under the microscope to give us a sense. A really in-depth look at one's basically head-to-toe evaluation. And it is way more extensive than what one would get certainly in a primary care setting, and additionally in a concierge internal medicine setting. In addition to that, we focus extensively not only on the blood work, but also on imaging and, again, actually visualizing what one looks like internally. So, again, head to toe, looking at your brain function, looking at how old the brain is, looking at the vascular supply and vascular health, if you will, of the brain, looking at mental health of the brain, looking at the age of the brain. So if one is 40 years old or 50 years old physiologically, how old is the brain? How well does it function? How well does it talk right to left, front to back? How do we cope with stress? How much of a yogi are we? And how do we protect this most powerful engine against aging and dementia, stroke, and cardiovascular disease? We do the same looking at the carotid supply to the brain and to the neck. So carotid arteries are the main avenues through which the blood gets pumped up to the brain, and we can also get the age of the carotid arteries, see how much plaque is building up, see how many jetties and turbulence is there in the blood flow. We do that right here in the office, in addition to the brain scanning, which is based on ultrasounds, and the brain scanning is based on quantitative EEG technology. So very much cutting edge. Then we can look at someone's heart again in the office by looking at their heart pumping function, by looking at their electrical activity in the heart. And then we send folks for imaging of the abdomen and pelvis, which is the number one territory where dangerous cancers can pop up, to an imaging facility just 5 minutes away from us. The reason why MRI is chosen is because it is radiation free, so we're not exposing our patients to undue damage, and we get a very high resolution evaluation of their entire abdominal cavity, of their pelvis cavity, looking at their bladder function and reproductive organs, as well as what's called visceral abdominal fat, which gives us a clue as to what the cardiovascular and metabolic function of their body is like. So it's a really comprehensive evaluation that's geared to look at one's health and well-being head to toe, and that one's that's tied and correlated with the entire medical history, genetic history, molecular history, psycho-emotional history, nutritional history, exercise, and coping history. We just get an incredible portrait with individualized risk for the person who's sitting in front of me. Not a standard guideline, but really what is your individual risk of cardiovascular disease, of 12 most common cancers, of inflammatory and autoimmune diseases, and what can we do specifically to address that and to mitigate and lessen that risk. So if you have any questions, please feel free to reach out to us at Preventive Medicine Cancer Care. Would be happy to address your questions. Thank you.